Hi, I'm Dr. Shaiman. I am on the faculty in pediatric gastroenterology, or GI, at Johns Hopkins School of Medicine, and I also have a limited faculty role at Baylor College of Medicine in Houston, Texas. I've been in practice since around 1996, and I've had the pleasure of taking care of children and adults with Prader-Willi syndrome since around 1998. And I'm going to talk a little bit about, or answer some questions that may be important about GI nutrition issues in Prader-Willi syndrome. And I thank you for the opportunity for addressing you today. Well, if you look at it, one, I wouldn't be giving this presentation today if there wasn't some relevance, so there must be some. And then two, if we look at some information that's been gathered, both from around 20 years ago, which suggested that GI symptoms were in adults a little even more common than skin picking, not as common as sleep problems, but that would suggest that that was there. And then in more recent data from the US, from the Foundation for Prader-Willi Research, where they asked questionnaires, GI symptoms like reflux and constipation and belly pain do occur. Fortunately, some of the urgent issues are not that common, but they can happen. So feeding issues are extremely common in Prader-Willi syndrome. It's one of the reasons that young children and infants are come and present with a diagnosis, because they have trouble feeding because their muscles are very weak. It's been part of the major criteria since 1993, and this happens due to several things. The muscles here in the cheeks and in the jaw are all something called skeletal muscle. If you look at a young infant with Prader-Willi syndrome, they're very weak. They can't lift their hands up. They sleep a lot. And some of the muscles that you need for feeding, both in the jaw area as well as the palate, is very weak, and it makes it very challenging for them to be able to eat, suck, and swallow. So that can, and then as they become older, the saliva is a little bit thicker and the palate is still high, so it makes it harder to transfer food and to successfully get it from in the mouth, into the esophagus. So if we have a challenge, we need to figure out answers to the challenge. So for young infants, some infants need some help for a few months. In my experience in Houston, we looked back at the children, the very young infants with Prader-Willi syndrome, to see if there were benefits from therapies, and we did see benefits. A lot of children will require a small tube in the nose that would go back to the back of the throat and into the esophagus and the stomach to allow a safe passageway as you build up strength to be able to safely eat. And the children that received occupational and physical therapy only required that supplemental support for roughly about 42 days or about 6 weeks. That was beneficial. The children that did not have the benefit of that support required use of a supplemental tube for roughly about 8 months. And then for children that used some things to make the work of getting the nutrition in a little easier, by using concentrated formula, or by using hind milk, which is the later part of breast milk that has more fat in it and more calories, or fortifying the breast milk so that it makes it more concentrated, so that rather than it being 20 calories per ounce, it may be 24 or 26 or 28. It makes less demand for how much you have to take in. So it cuts the amount of work that you have to do to get the calories in. So using those type of things, with adding both of those together, it took it down to about 35 days that you needed to have support. So those type of therapies help with young infants and children. It's not perfect for everyone, but it helps quite a bit. If these continue, and there's more information that's been coming now, there were some subtle suggestions that there may still be issues in older children, looking at children that would be choking after they ate some food. And some recent data that's come out for about the last 7 or 8 years suggests there may be issues still with having fluid go into the lung, or potentially have food sticking in the esophagus. And the concern there is that the older children and adults have not been aware of this at all. So the things that may be helpful would be, one, to define whether there's a problem or not, and then two, to meet with a speech pathologist to see if there's an issue in this area. Should we use a straw, to be able to help get the liquids through safely? Should they learn how to safely, time things? Do the liquids need to be thickened? And if it's a problem with food, then learning different strategies to be able to eat so that you slow down how fast you chew, which is appropriate for everyone. We eat too fast. I'm guilty of that. And then also taking in liquids with solids at the same time, so the liquids can help move the solids back, as long as it's done safely. And then regrouping with the speech pathologist who might have helped earlier in life with speech and articulation, but they also have a valuable role in swallowing, and looking at strategies for that. And then if there's the potential for reflux can also cause acid to go into the esophagus and then make it hang open, and that can cause more issues with how the esophagus works. Then making sure you talk to a provider about treatment for reflux if it's appropriate. Potty training is a normal problem for most children, whether you have Prader-Willi syndrome or adults. So making sure that you have some of the basics are important, to make sure that you have very good posture when you're sitting at the toilet, that you don't try to toilet train too early. If somebody is not ready, then don't start. But working with a psychologist or developmentalist on looking at the timing and the cues. And then when it's time, then you want to make sure that you're setting your kid up for success by making sure that they're using a seating system that allows them to have their feet square on the ground and not dangling at a toilet, and that they're able to have good posture can be helpful. And then then looking at what the stools are like. Having a firm stool may not be the best. Having a nice soft stool, which is easy to pass, may be helpful. And there are a variety of different nutrition therapies, as well as medication type of supplements that can be used to help address that. And those would all be available, I think, through information from IPWSO and PWSA USA to discuss in more information. Again, the goal is not to alarm people, but just to educate people. And I think the really key thing, which in PWS is important to keep in mind, would be 1, the drive to eat. 2, the very high pain tolerance, and then 3, parents know their children best. So and then 4, to be aware of the opportunities to binge and the power of hyperphagia. So if you've been to a holiday event and there's been access to food, and then suddenly that evening your child or adult comes home and their belly looks full and they seem very kind of lethargic or bloated, that could be one of those urgent things, where we talk about the gastric dilatation. And that would be important to make sure that you are aware of the algorithm that's been published, that's available through IPWSO and PWSA USA, so that you have a good idea of what you need to do if things progress further. If it seems like your child is or adult is a little bit under the weather, but otherwise fine, I think you could potentially monitor closely and follow like what you would do for your other children who have a tummy bug. You might use clear liquids, watch them closely, for the next 12 to 24 hours. And if everything settles out, then gradually resume back to their prior diet. If this became a recurrent problem, then you'd probably want to talk to their healthcare provider about other evaluation. If, however, they just seem like they're having belly pain out of the norm, they're vomiting, and they don't usually do that, or they seem extremely lethargic, those would be warning signs for anyone that they probably should go be seen. And I think the key there would be to make sure that the healthcare providers that you see in the emergency room are aware that Prader-Willi syndrome should be handled a little bit differently than a typical person that comes to the emergency room. That they may not give good histories or information for them, and it's important for the care provider to give that information, and that they may, very much downplay the amount of belly pain they're having. And so use the other societies, use the algorithm that's out there for what to use. And sometimes, for Prader-Willi syndrome, things like gallstones that for an adult would cause you to have very severe belly pain, they may just stop eating and just say, oh yeah, it hurts a little bit over on my right side. So keep in mind medical issues that may run in your family, because just because you have Prader-Willi syndrome, you may wind up with something else that's also in your family that just is there. So I think it's more, respecting the features of Prader-Willi syndrome and how they can impact on common things. And then, reach out if you need help. In summary, I think the important things are to, from the beginning, you're going to hear from other people that'll talk about the value of good nutrition. I think, building a healthy diet, having good healthy building blocks, working closely with the dietitian so that you can, set up a very, very good and balanced diet, even if there's some restrictions on how much you eat and drink, are important. It's important for infants that you utilize the therapist that you can during infants and childhood, but then realize you may want to bring them back into the fold if, for example, the concern about swallowing is there, because that speech pathologist who is your best friend to getting your child to articulate may also be able to give them some tips to be able to successfully swallow normally. And then again, keep in mind the other features of PWS, both with the weak muscle tone, the obsessive compulsive type of behaviors, and then the high pain tolerance. Because they're pervasive in other areas and they can also bother the gut. And then no matter what, enjoy them. They're a gift and they're a pleasure. And thank you so much for the opportunity to speak to you today.